Hi, everybody. I'm Dr. Allison Apfelbaum from Tree of Health Integrative Medicine Clinic in Woodinville, Washington. I'm a naturopathic doctor, and I'm here with another naturopathic doctor.
And that is Dr. Renee Plummer. And I am a naturopathic physician at Health Moves in Woodinville as well. We are two Woodinville naturopathic primary care physicians right now wanting to be a voice for our community. I know that in the midst of COVID-19 right now, people are fearful, people are having to adapt. And I think that is just where I feel like we as primary care and naturopaths want to be there for our patients, letting them know that we are available to you right now via telemedicine. It might not be our preferred method of speaking because we're not very natural in regards to having to record and do things from home, but we really just wanted to team up together, join forces in trying to be here for our community because we are thinking about you on a daily basis.
Great. Yeah. Are you at your home office right now?
I am right now. I'm in my makeshift office trying to get good lighting right now. But just trying to create kind of a workspace given the next couple of weeks being that we're, providing telemedicine appointments. And we've obviously adapted to what Governor Inslee has wanted in terms of the mandate of staying home and staying healthy. So I've been at home. And
Yeah,
you look like you're at home too.
Yeah, I'm at home too doing telemedicine. Dr. Plummer has asked me to get together with her so we can talk about Woodinville community, so that we can talk about COVID and the who, what, why, where, and how, what's next, and also a little bit about telemedicine and how that's been affecting us and our practice and how it can help everyone. So do you want to tell me a little bit about what your experience has been with telemedicine for you?
Yeah. So, I went to Bastyr University, and Dr. John Bastyr emphasized the power and healing of touch, of the human touch. So something I really enjoy is obviously seeing patients one-on-one, but given the circumstances, I've been able to provide Zoom visits, telemedicine visits currently. It is HIPAA compliant, so it is something that is going to be safe for my patients to try to have to access with our visits. So it's still something that I feel is safe and definitely user friendly. And I've just been providing telemedicine visits 4 days a week at least during this time with our new office hours. So now we are currently going from 10 a.m. to 5 p.m. Instead of the 9 to 6 that we've been doing for 5 days a week. So we've definitely minimized our hours, but we are still providing office visits. So I've just been doing some general management, kind of doing some medication check-ins, just making sure that patients have whatever meds that they will need and or supplements right now to not only support other conditions that I've been managing with them, but also to provide them with some support for their immune system if they feel like they need so.
Excellent. Yeah, I think I have a similar answer, but I think the conditions really being helped are like anxiety, any kind of like stress around the situation. There's a new ICD-10 code like specifically for that, even like a triaging of does this person need to be tested for COVID. And so it's been a good opportunity to kind of see those people virtually right now until we can get back to normal things. Of course, I saw this post, one of our colleagues, like they miss looking into ears, and I have to agree, I miss that. I miss the physical exam part, but this is what we have to do right now, and it's a good option. Our clinic is also providing like curbside pickup and supplement, like you can prepay and still get your medications and supplements that you need. So we're all trying to make these changes to, to keep everybody safe, really. Yeah.
Yeah. And a lot of those questions too that patients have, even just about the virus, we've been keeping up to date with recent research and the news and all of the rates given the different changes, not only just daily, but hourly.
Yeah.
So we want to keep up to date with that as well. So if our patients are asking those specific questions, we want to have at least some answers for them.
Yeah, it's been crazy trying to read up on hours of information, new changes, trying to watch all the like press updates, not only here, but like my family's in the East Coast and, we want to keep up with all the states. So it's been very challenging and interesting, a lot of extra work and kind of on the side, I think, to keep everyone informed. Well, let's talk a little bit about COVID in general, because I feel like people are bombarded with information, but we are health professionals, and I feel like we're kind of like the source of where you would find that information and that accurate information. Let's start with who would be most affected by COVID at this point in time?
Yeah. So we're hearing a lot in the news right now about patients who have had pre-existing conditions that are going to affect more of respiratory illnesses, either if it was asthma or, uh, COPD or common symptoms like recurrent even pneumonia or lower respiratory issues. Those patients are at higher risk, but we also, given the understanding of the pathophysiology of the virus at this point, need to start thinking about ACE receptors, and with those patients, those ones have cardiovascular issues and illnesses like hypertension that we have to think about as well. Most Americans are on hypertensive medications. And so those patients who might be on ACE inhibitors or angiotensin receptor blockers, they might be at higher risk as well. So it's not just, I think, a virus that's affecting the lungs, but also even cardiac issues as well. And we can find some of those ACE receptors on lung tissue as well. So
Yeah, and kidneys and liver. So I think it's important to note that like patients with kidney conditions and any kind of like major organ status of being severe, they qualify as like severe risk. And then I would say there's like moderate risk, like people with diabetes too. And there's a lot of people with diabetes and pre-diabetes walking around. And then the age groups, like they consider older than 60 or 65 as being more high risk. However, let's take somebody that vapes, that's 30, and they definitely have weakness in their lung tissue. So, or people with like cystic fibrosis, or maybe you're on maybe you have a autoimmune condition and you're on an immunosuppressive drug.
right.
Funny enough, the treatments coming out are immunosuppressants, but they're
But
supposed to be used like in that last, like when you have it, right? Not before. So taking it doesn't necessarily prevent you from getting that, right? Research is still coming out. Well,
yeah.
I think we're learning more about it every day, and that information is coming out. What about what it is? Is this a flu? What is this? What is this virus, COVID? Actually, COVID-19 is the condition, right? And the actual virus is actually called like SARS-2, like
Yeah.
actual virus. And it's a coronavirus, but so was SARS and so was MERS.
Mm-hmm.
A zoonotic coronavirus came from an animal, they think, from a bat to a pangolin to then the market and then a human, and now it can be transmitted human to human. And it's not the flu, it has a higher mortality rate. It's very, 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 very contagious. These are the things we know. We know it's transmitted through aerosol and fomite, which means surfaces. And so here we are. We know it has a very, very long incubation period, like 2 weeks. So you could be asymptomatic and spreading it. So, all these things are contributing to this pandemic.
Mm-hmm. And just the easy transfer between people. I mean, respiratory air droplets, they're talking a lot about even what does that mean? Does it mean that it could be close to us or 6 feet away? Either way, the CDC is trying to be preventative in a lot of their rules that they're setting just in the general public of how we could try our best to prevent transfer at this point. And, given the statistics of the age population that it's supposedly still affecting, some of us know people or loved ones that might be younger than 65 that had been affected, just given the current epicenter of New York and New Jersey. When you look at the percentages of people who are affected and what age population, it's not just our elderly that we have to take into account. So absolutely, like making those makeshift masks are going to be important.
Yeah, I mean, of course, respiratory droplets could transfer up to 6 to 10 feet, and so that's why the social distancing has been very important. So let's see, where is it getting affected? Well, we know where it started in America, and it started right here in Washington State, the first case that they know of, right? Because there might have been cases elsewhere, but that we know of. And then from there, it's affected the nursing home, the isolated case, but it's also because of planes and travel, it's spread all over now, right? Which is how it got here from China too. And I think that density is really being affected right now. You see that in Detroit, you see that in New Jersey, right outside the city. You see that in New York City for sure. Philly is getting hit pretty hard, Philadelphia. But also mitigation needs to happen early enough for that to be prevented. And California did that pretty well.
Yeah, absolutely. And you had just mentioned today about what the governor of California said about what steps we're going to be making in the mitigation phase. I know a lot of people are having questions about, when do you think this is over? I mean, it's a really difficult question to answer right now, since a lot of people are utilizing different approaches of how they want to flatten the curve and at what time they had started doing so. We can see a huge discrepancy between maybe some of the areas in the states in the South from some of the regulations that's going up north, and also on the West Coast here. So
and I think we're going to be able to see those positive changes in the next coming month, especially in the places that were hit early, but they mitigated early, like Washington, California, Oregon. We've been doing a really good job. The curve is flattening. Although the cases still start going up, you have to look at the number of new cases daily to really track it. And we are flatlining, which is awesome. But everybody's kind of wondering, hey, when are we going to get back to normal? Well, what is that normal going to be? And that's, I think, what we need to start prepping ourselves for, is like the next phase after mitigation. How are we going to open the economy safely? How are we going to get back to seeing our primary care patients but not put people at risk? So this is what the government will be coming out with in the next couple of weeks, I think, as a plan, more testing, tracing contacts of people that are positive, social distancing within the places that we frequent, and protecting high-risk people, whether that's them isolating or wearing protective masks, or everyone wearing masks.
Or designated time periods still, where for grocery stores or at regulated hours, temperature checks before entering and leaving a building. That could be also something that happens. So it's definitely going to be something that we have to watch out for, but it could also vary on particular businesses and how that might impact that as well. But on our end, as primary care physicians, and we know that we want to get back to doing some procedural work as well, and just figuring out what we're going to do to make that happen.
I think that the restaurants is going to look different. I think they'll have to put tables farther apart, maybe fever checks, like you said. I mean, they're already doing this in China and other places, and it works. And so it's not forever, but it's like, if you think of mitigation as phase 1 or phase 2, we need the next phase, and the next phase is to open our economy safely while protecting the community and essentially bridging what we call herd immunity. And we're not assuming everyone is in herd immunity. We're not there yet. And the vaccine won't be here for a year. And the treatments are only starting to get tested. And they're really only for people that are already infected and having troubles. So
Mhm.
what we're looking at is prevention in a way that's like extreme across the nation, and something that's it's gonna work, and it is working. We have to have that faith, and we have to do it together. Interesting. Well, personally, I feel like this is a good time to utilize telemedicine for like mental health, like stress and maybe hormone checks and things that we don't necessarily like. It's not urgent or emergent.
Right.
Yeah.
Right. Yeah. And I definitely think that this is our time to, we don't have control over when things are going to be able to come back to us, but what we do still have control over are things like our food and also our sleep, and things even like exercise. I know that we've been practicing social distancing from people, but we should also potentially start practicing that towards our refrigerator as well. So I think given social
Yeah.
distancing,
The quarantine
sometimes, and like,
snacks.
yeah, checking in, making sure, is this boredom or is this really what my body needs right now?
Yeah.
It's, yes, we are still all fearful, but that is something that if you have the opportunity and with the advice and consultation of a healthcare advisor, I think this is a wonderful opportunity for you to start thinking about those things that you might not have had time for before.
I love
So that's, we're
that.
here to
Yeah.
help.
I love that. And I think creating a routine, like getting up at a reasonable hour, getting dressed, like working out 30 to 40 minutes a day, whether that's a home exercise, and connecting with people virtually, whether that's like FaceTime or like Zoom or calling or writing, or like I've been making these headbands for medical professionals with little buttons so that they can keep away from their ears, and literally, so I'm selling, like I'm not even selling them, I'm just giving away, but like people want them so bad. It's crafting. It's like finding those things that you're like you don't normally do, but they like give you life.
Yeah.
But I really think it's important to, yeah, enjoy your time, hang on, try not coping with stress unhealthy, whether that's food or alcohol or like sitting around watching Netflix. I think that we should limit the screen time, try to get outside in nature, whether that's in your backyard or your neighborhood, and enjoy this time. I mean, when are we ever gonna not like work and be at home like for long periods of time? So um,
Yeah.
I think it's all important. Well, this was really great. I think that, we should share this with the community. Any last thoughts or anything you're thinking?
Yeah, I just, I had this idea and, thought about obviously a wonderful other healthcare provider, but just thinking about the fact that I just want everyone to know, whether you're in Woodinville or not, we are here. We might not be in the front lines in the hospital, but we really want you to know that we want to be there for you. And it is possible to make that happen, that you don't have to go through this period of uncertainty alone. And I just want at least my community to know that, and our community to know that. So just get out there and feel free to, reach out via obviously phone and not through our hands, but just to know that you are not alone and that you have someone that have people that want to help.
Yeah, and I agree. And I think that, it's important to just know that this is temporary and this will pass, and just hang in there, and everybody is keeping each other safe. There's a community of people, and we will continue to do that and get back to somewhat normal life, and it will be okay. I'm Dr. Allison Applebaum. I'm a naturopathic doctor at Tree of Health Medicine in Woodinville, Washington. You can go to our website at www.treeofhealthmedicine.com.
And I am Dr. Renee Plummer, naturopathic physician at Health Moves. You can find us at www.healthmoves.org.
All right. Have a good day.
All right.
Thank
Take
you.
care. Bye.
Bye.